Welcome to North of 60. My name is Heidi Schweighofer. My guest today is Dr. April Yanda, a dentist here in Hudson with her business partner, Dr. Keith Hoover. Dr. Yanda's been a greater Cleveland resident her whole life. She's got her Doctor of Dental Surgery at Case Western Reserve. She's held a number of offices with the Greater Cleveland Dental Society and is a delegate to the Ohio Dental House of Delegates. I've practiced that a couple of times and I blew it. Is that a statewide kind of position?
Yes, it is. The Cleveland Dental Society, we have constituents all through northern Ohio. And then we represent Ohio. We represent our little niche, which would be Greater Cleveland, to the whole Ohio Dental Association.
Thank you for coming today. Now, I want to start, before we talk about teeth, I want to ask you though, how did you get started in dentistry?
From the beginning, I've always had like a desire or a passion for the medical field. And so during college, I looked at different specialties and I volunteered at Rainbow's Babies and Children's Hospital in the dental clinic. And I just found that that was just something that just took over my passion. And I loved working on children. And I made it kind of my mission to change the world one smile at a time.
Oh, so. That is wonderful. Good for you. And your daughter.
Corny, but.
No, but it's relevant. Your daughter is a dentist too, so she's like mother, like daughter.
Yes, and we didn't think that she was even wanting dentistry, but during her first year of freshman when she was at Miami University, she said, you know, Mom, I think I want to go to dental school.
Oh. You must have been so proud.
Oh, yes. So she's an alumni also at Case Western Reserve School of Dental Medicine.
Oh, wonderful, wonderful. Well, all right. Now, today we're going to talk about teeth, and we're going to talk about those of us who are over 60 and what happens to our teeth as we age. And I know that one of the things that I wanted to really understand is, why do I see so many older people wearing dentures? What happens?
Okay, so the thing is, unfortunately, people who grew up in the 30s, 40s, 50s, fluoride just wasn't readily available. It wasn't until It wasn't until 1951 through 1960 that fluoride was introduced into the water systems.
I didn't know. Okay, keep going. So, what about in toothpaste? Was it in toothpaste at that time?
Fluoride was in toothpaste at that time, and that's why we found that it definitely could stop cavities from occurring. And the water system, so now we have water, it's 1 part per million of fluoride that's in our drinking water. And what that does is it systemically goes through the system so that you can have fluoride throughout the body, and the teeth then become strong and cavity free from the fluoride.
Okay, so because we didn't have fluoride, or a lot of older people didn't have fluoride for so many years as they were children, their teeth then are not as strong as a younger person's might be today.
Right. So in the 40s, 50s, and 60s, they put filling material in, which was a metal amalgam.
Yes.
And the metal amalgam was a conglomerate of all kinds of metals plus mercury. Unfortunately, these metals tended to cause the tooth structure to become weak. If you can think, we have a big metal filling sitting inside your tooth, and as you're biting, it's really acting as a wedge, and it starts to break teeth away, the pieces of your teeth away. And so many people have lost teeth due to these large fillings, large decay, and sometimes a filling cannot be replaced with just a filling. So the tooth tends to need a crown over top of it.
All right. It seems like bridge work and dentures are a little bit something of the past. Now I hear an awful lot about dental implants. I know nothing about them. So can you talk about what it is, what happens, who needs it, the whole spiel?
Okay, well, it's great to be living in a world of state-of-the-art technology. And so implants are an integral part of that. So we have several different options for replacing missing teeth in dentistry today. If a tooth is needing to be removed, what we need to do is first get a scan. The scan is a 3D scan. It's called a cone beam CAT scan or a CBCT scan. And what this does is it helps us to see how much bone is there, the amount of bone, the density of bone, and if the bone is good. So if the bone is good, then we can decide how to replace and what we need to put in that space. So we look at doing bone grafts first. So the first thing for an implant would be to have a nice harvest of bone. So we can do that by either getting bone from ourselves, autogenous graft, which we take bone from the chin or the ramus, which is the back part of the jawbone.
So surgery.
So surgery would be involved with that. Or you can do an allograft, which is just like bone pieces, bone particles. So that can be done. So once the bone is nice and healthy, then what we do is, if we look over here, is we place a titanium screw into the bone. So the titanium screw is placed in the bone by an oral surgeon, and it has to osseointegrate. So basically it's just going to fuse into the bone. Now that takes time. So anywhere from 2 to 4 months of healing.
For just the screw part?
Just the screw part. So then after that, what we do is we put an abutment or a platform right over top of the implant. That platform, I put that in, or a general dentist. Your general dentist can put that in. And then we place a crown right over top of the platform and the implant. So the good thing about implants are that you can floss in between them, and they feel like your own teeth. Like you can chew, you can bite, and it feels like your tooth.
Even with the screw in that, you don't, after it heals, you have no sensation of this is where my dental implant is.
No, I think it feels normal and natural.
Can it be done in numerous teeth? Can you do it in, if this poor person had lost 3 other teeth, can you do as many implants as you have lost teeth?
Let me see if I can find mine.
Oh my gosh.
Here's one that you can do multiple implants. And sometimes we can even do bridges, which is an implant on the anterior or the front part of the tooth, implant on the back part of the tooth, and so the whole thing can be a bridge, which is really wonderful.
No kidding. All right. So this has taken the place of people's plates and the whatever. My parents had fake teeth that they would take out and put in a jar and then in the morning replace them. And teeth on a bridge, I guess. I don't know what those things were.
Right. So
they were gross.
So there's a couple of different things. I think if patients need to have something removable, this is a nice removable appliance. It's called a Valplast partial. It's very flexible. The teeth are placed on these pink acrylic bases, and we have state-of-the-art plastics now. So if you can see, the clasp is tooth colored. So you don't have those old metal clasps anymore. Patients love this because it's flexible and it's thin and you can. But the only thing is it's removable. So
but
people,
maybe that would be okay.
That can be okay, and but a lot of people don't want removable. A lot of my patients are asking, "Gosh, I have this old denture that just floats around. Can you do anything for me?" So what can be done too? We have the state-of-the-art dental implants that are placed strategically into the jawbone, and if you have a denture, we put buttons on the inside of the denture, and then snaps right into place.
And stays there?
And stays there. Now it comes out at night. You just take it out and clean it. But patients, if you've ever seen maybe your old grandparents and they've been chattering around, their
and
teeth
out comes
move.
the denture.
Yes.
Yes. I certainly have. I have very many memories of that with my in-laws. So very attractive.
But this just snaps into place, which is quite nice. Now, a little more costly, where we put the strategic implants in, then a fixed bridge unit can be screwed right into the implants, and this is not removed. This stays in your mouth.
So this would be for someone who has lost a number of teeth in a front area specifically.
Yes.
And so you keep it in, and that's like your new teeth again.
Yes.
Dr. Yanda, I never knew, by the way, any of this existed, especially these. I think that's fascinating. Tell me, in terms of cost, that's always a concern. You don't have to be exact, but from would you say most costly dental implants to least costly would be maybe the bridge, the removable plastic bridge?
So I think you're looking at close to maybe $5,000 per implant.
Oh my word.
Sounds like a lot, but oh my gosh, it's a huge investment in your mouth. And believe me, my patients just say to me, Dr. Yanda, I am so glad that I had these implants placed. I had a woman who was 90 years old, and she had all her own teeth. She did not want to wear anything removable. And she said, could you please put an implant in for me? We did, and after she was like, that was the best thing I could have done in my whole life.
So you can actually do them then at any age?
Any age, yes. Now, the fee that I said around $5,000 is just the fee for the oral surgeon placing the implant, the bone graft, that platform we talked about, and the crown. I mean, so there's a lot of surgery involved.
Yeah, especially if you're taking it from the jaw and so on, yeah.
But I mean, I just want to be realistic to people, because I don't want them to think, oh, that's just $1,000 and I can have a whole implant.
Where do they start with their dentist and then you do the referral to whoever needs whoever goes to the surgeon, or do you do the whole thing from soup to nuts?
So there are some general dentists who might do implants. Again, I have a specialty in aesthetics and reconstruction. So that's my expertise. So I send extractions and implant placement to oral surgeons, and because that's their expertise.
Yeah.
So they do the surgery, the bone grafting, and then I'm like the quarterback. So they'll come back and we'll check things, follow up. They will go back to the surgeon maybe for post-op, for uncovering, and then I choose where to place the restoration. I do custom abutments or custom platforms that we talked about, and then custom crowns.
Is this permanent? If I have one at 67, am I unlikely? Will I go to my grave with an implant?
Well, we would hope that you could go to your grave with the implant.
Me too. Because doing it once would just about be enough for me, I suspect. But
so again, back in the 80s, we thought, gosh, this is great. Implants are going to be in there for the rest of your life. You're not going to have any problems because the titanium is very friendly to the bone. And so when they would put titanium rods, pins in your knees and hips.
Knees and hips, yeah, I was going to say.
They last a lifetime.
Right.
Unfortunately, unlike the knee where it's totally closed, an implant has an oral environment now to deal with. So we have bacteria that cause gum disease and germs that can get underneath the gum and cause a term called peri-implantitis, which is gum disease of the implant. And we never thought that would be, but now we're fighting, we are fighting gum disease around implants. So I just want to stress to everyone that just brushing, flossing, and seeing your dentist, sometimes every 3 months, every 4 months, every 6 months is so crucial in keeping our teeth for a lifetime or keeping our implants for a lifetime.
That is, and it seems as though a lot of older folks that I know go not quite as often as that anymore. I think they think, been there, done that, don't need it. As long as I brush and floss, I religiously go every 6 months, and I have been glad because they found things before they've turned into big things, which I think is like preventive.
Right. I think, so dentistry is definitely having a shift from reactive to proactive and doing a preventative program for everyone. So the thing is, I think if you can find something that is like a small cavity, we're able to fill it. If we wait until it's larger, then it turns into a crown or a root canal. And if it gets even to that point, you could have gum disease, the teeth become loose, and you could have the tooth would need to be removed.
You just hit two topics I want to ask about. One, oh gosh, I just thought of a third. All right. Number one, cavities. We can still get cavities even though we're in our 60s, 70s, 80s, correct?
Yes. So the thing is, as we get older, there's many factors that can contribute to cavities. The top being dry mouth. So many people older than 60 years old are on many different kinds of medications, and over 500 medications, their side effect is dry mouth. So once you have dry mouth, the gum tissue can become red, puffy, and it starts to erode away or recede from the teeth. So once it recedes, then the gum tissue has bacteria, and the the gum tissue can start to pocket around the teeth, and then that is basically periodontal disease. Over 70% of adults that are 65 and older have some kind of periodontal condition.
Oh, good Lord.
It seems crazy. But I still think dry mouth is definitely a huge factor in causing cavities and causing other oral health issues.
So moving from that into root canals, I had one. I don't to this day really understand what was going on that made me have one. So can you talk about why someone needs a root canal and exactly what it is?
I have a little, I don't know if I can put this here. Well, it's a little picture. Sorry, I
love pictures.
I had some more. Maybe.
Oh, perfect. That's perfect. Right
good?
There, yeah.
Okay, so let's talk about a root canal. So there's times when, there's times where you can't just put a filling or a crown on the tooth, where the nerve and the blood vessel become diseased and die. So what we have to do is we enter into the soft core of the tooth. Okay, we're going to call that the dental pulp. So, so the dental pulp is the living portion of the tooth, and that contains a nerve and a blood vessel. So the nerve and the blood vessel run from the crown portion, or the top of the tooth that we see in the mouth, and it runs down through the root to the apex, or the bottom of the root. And so when the nerve is diseased, or again, the decay has gotten in too deep into the living portion of the tooth, we definitely remove the nerve and blood vessel, but we replace it with inert rubberized material called gutta percha. So that seals the inside of the root, and it seals it from any germs or bacteria. And then we are able to put a crown over top of it, so that now the patient isn't going to have any pain associated with that particular tooth.
Do people know they need a root canal because their dentist tells them they need it? Or is there pain associated with the tooth? It sounds like if this is infected, there'd be pain associated with it before one even goes to the dentist that day.
Right. So there's a couple different things. There are instances where you feel no pain and you need a root canal. That could be when the diseased dentin or a cavity has penetrated deep into the tooth and started to eat the dentin, the second layer of the tooth, away.
Oh, gross.
So sometimes people feel nothing at all. The second would be pain, of course, swelling when there's infection. And that's what gives really root canals a bad name, is because people are so swollen and they're in so much pain, and now the dentist has to try to anesthetize the tooth and get them out of pain, which, you know, is almost, I won't say it's impossible, it's very hard to do that. And so a lot of times patients will say, I've had a root canal, I was in so much pain, but we don't ever want it to get that far. Once it gets that you have infection, I mean, it's way too far. That infection can get in and cause all kinds of problems, you know, with our systemic health condition. So again, that brings it back, like, you should see the dentist, have x-rays. Sometimes I can't see you know, what's going on underneath the gum and the bone until I take an x-ray. And if I see the x-ray and I see infection starting or some inflammation, you know, then we might want to get in there and do something just like what we talked about before. If it's smaller, try to get in and do things before it becomes larger and more costly and affects our health.
You know, that is a very good point. When I have gone to the dentist periodically, and a person will come in and say, oh no, I don't want x-rays this time, or I just had them a year ago and I don't think I need them again. But maybe we do need them every year so that the dentist can see what's happening underneath the surfaces.
Oh, definitely.
So you could detect it beginning before I can detect it beginning.
Oh, yes, yes.
Okay.
And then again, I think that's due to the x-rays and for us to be able to see that.
Yeah.
Right.
I want to talk about fillings a minute.
Okay.
Because I had the metal fillings, of course, since I'm 67, and they were gradually removed and they put in white fillings. I don't know what they're made out of, but
composite material.
And they're fine. But I've had some friends who've had, like, gone to the dentist and had every single filling from the metal ones removed at the same time, in part because of the leaching of mercury. Now, is that valid? Do you see that happen? Are those old metal ones still there in some people?
So I think I have the philosophy, and same thing with the ADA, that if the metal fillings are in your mouth and there's no cracks, there's no open margins, there's no decay around them, I think they're perfectly okay to keep in your mouth. Unfortunately, like we talked a little earlier, most of these metal fillings were placed you know, in the 40s, 50s, 60s, you know, 70s.
Right.
80s, maybe not 80s, but you know, so they've been in there a long time, and most of them are starting to corrode and the margins are starting to open. And as you bite down on the tooth, as I said before, it acts like a wedge, and so now you have cracks all along your own remaining enamel. And so it's really kind of good if it's a large one to remove it. And unfortunately, then a filling usually can't be replaced inside that space because the filling was so large and the tooth structure around was so small and weak. So then a crown will need to be placed over top of it.
I think removing an old metal filling led to my root canal ultimately because it just didn't. Okay, that's interesting. Now, all right, let's check. Oh my goodness gracious. I had no idea we've been talking this long.
Okay.
Okay, let's talk about one more thing quick, and that is COVID. All right, so we're in the middle of COVID still. What do you see dentistry doing now in this COVID era, I guess?
So definitely we have concerns about, safety and the coronavirus. So I just want everyone to be rest assured that, we are always maintaining a safe environment for you to come to the dentist. So we want to protect our patients and as well as our team members.
Sure.
So what we are doing is we have our patients stay in the car and we call them or they text us so that we don't have a lot of patients in the reception room.
Good.
So we're kind of mitigating, the
crowding thing.
Crowding,
yeah.
Yes. We ask a series of COVID questions.
Good.
And then we also take a temperature. So we take everyone's temperature before they come back to the operatories. And so if everything's good, we take them back to the operatories and we do a rinse of hydrogen peroxide, a 1% rinse.
I just had that when I went to the dentist last month. I just had that.
And so that's good just to mitigate the bacteria. So if we have to do some aerosol where we are grinding on teeth, we have state-of-the-art high evacuation suctions that we use. And one that I use in my operatories is an IsoDry. So it's an apparatus that fits in your mouth. You bite on a little bite block and it keeps your mouth open, but it has an internal suction. So the suction is inside your mouth.
Oh, cool.
And it helps to mitigate any aerosols.
Yeah.
So.
Oh, very, very interesting. Can see? I told you the time was going to go flying by. Thank you so much for being here, Dr. Yanda.
Oh, thank you. Thank you, Heidi, so much for inviting me.
Well,
I really enjoyed our talk.
So did I. And thank you so much for watching North of 60. For information about Dr. Yanda and her office phone number, we'll have that information at the end of the show. Thank you. Bye-bye.